Hi, everybody. The Family to Family Education Program is a free 12-week course for relatives or caregivers of patients with mental illness. It's available in Hudson, in Spring Hill, Land O'Lakes, and the Ocala area, and is approved by the National Alliance for Mental Illness. More than 300,000 family members have graduated from the program, and they assure us it works.
It was scary because I didn't know how to help him.
We just really didn't know how to manage any of this.
I was very fearful because I saw my daughter and our family headed to a very bad place.
I mean, it was just too much.
And joining us with more in our studios, we want to welcome Pat Simone, who's with the Pasco County chapter of NAMI, and also Kevin and Suzanne Fulford, who have gone through the program. Did I pronounce your last name correctly?
Yes.
Fulford? Okay, thank you for coming in. Thank you, all of you.
Thank you for
Pat,
having us.
describe the program for our view at home. How does it work?
It's a 12-week program, and what it does is informs people if they have loved ones that have schizophrenia, bipolar, any of the mental illnesses, to understand what their family members are going through. There's information for updated medications. There's quite a bit of information that they receive over a 12-week period of time.
In listening to the interviews with relatives who've gone through the program, it seems that what they talk about most is getting that information that with news they can use, with information that can help them in their daily life, coping mechanisms and things like that.
Absolutely. That's part of what we teach in the 12-week program.
Why is it that the focus in so many areas is on the patient and not the support system around the patient? Why is this so different?
Well, actually, that's exactly what it is. This is for family members who are living with members of their family that have a mental illness, and this is a way for them to be able to relieve stress. It's a way for them to be able to understand. It's a way for them to be able to relate to their loved one.
Kevin and Suzanne, I so appreciate you all coming in. It's a topic that, is taboo in so many homes. They'd rather not talk about it. Kevin, you suffer from, is it depression and anxiety?
Yes.
And so how has being a part of this program helped you with your wife and the kids? And
it's helped us tremendously. We have other family members as well. I have a long family history, so it's so important, I think, for people to start talking about it. And a lot of folks just don't understand that people don't want to be this way. It's not a choice, and they think, well, they should just act this way or do that, and it's just not that simple. So for others to understand the illness changes the whole perception in the way the family interacts, the dynamics in the household, everything. It's been tremendous. I know it's been a great resource for my wife because she has to put up with me and others. So,
what was it like when the two of you were going through the course? When did you start to think, wow, I think this is going to work for us?
Well, early on, it was an eye-opener. Every second of every lesson is like, wow, now this makes sense. I understand this makes sense now. And then there might have been some times when it was a little bit of guilt. I wish I'd done this differently. I wish I had seen it differently, or I wish I knew about this sooner. So many people need this, and it's just a topic that's not talked about nowadays that really just needs to get out there for everybody to understand mental illness.
What's your message, Suzanne? I see you nodding your head.
Well, I agree with Kevin. This affects so many people, and I know me personally, I used to be a kind of person that was like, well, just change the way you think. I mean, I don't understand. So when I realized it was actually a chemical imbalance in your brain, kind of like diabetes and insulin and all of that, and it really was more of a medical thing,
right,
not a thinking thing, especially initially. It made a big difference.
And we're going to have so much more information on our Facebook page as well so that folks can learn more about the program. If you would like more information on when the next course is coming up, you can call NAMI in Pasco County, and that phone number is on your screen. Thanks for watching, everybody.